Hello, Miss Anderson. My name is Alonso. I'm a EPCC student, and I'm here doing my clinical orientation. And the purpose of today's meeting, the reason why I'm here is I have to do a teaching to educate you a little bit about any problems that you might have. As we discussed before, you told me your main problem is your smoking.
I have been smoking for a while.
So we'll get to that, and I'll give you a little bit of education and things that you can do to help you with that. So are you okay with me giving you the teaching right now?
You know, to be honest with you, I've been smoking most of my life since I was a teenager. The hardest thing about trying to quit is that I find myself always going back. I'm just frustrated and I don't know what to do.
Do you know some of the things that smoking causes?
I've heard a couple of things, but I'm not really too sure about it. What do you have to say about that?
Well, I'll give you a little bit of information once we get into those details, but I have a little bit of questions for you. Have you ever tried doing something as far as, going out and pursuing options and quitting?
What I've tried is sometimes I find myself that I buy those gums, those little cigarette gums, and I chew on that. And that seems to help me for a little bit. But then I notice that they only work for a little bit. I don't know what to do. It's just so hard to quit.
Okay, and do you know any resources outside of your community that can help you with that situation?
I don't know much. Can you guide me through that?
Yes, of course. That's kind of the purpose of the teaching. So we'll go ahead and start a little bit. So to give you a little bit of information regarding the complications associated with smoking. So smoking, what happens when you smoke, there's a lot of carcinogens in those cigarettes. So even though you're
What is carcinogens, Alonso?
So carcinogens are basically chemicals that are dangerous to your body, and they have a lot of industrial uses, and the purpose of them is to basically have something to do with industrial things, and they end up in the production of cigarettes to kind of get you to be able to absorb that nicotine. And while you're absorbing the nicotine, you're also absorbing a lot of those carcinogens, which are causing a lot of damage to your body. Okay.
Oh, wow, that sounds scary.
So when that happens, you put yourself at risk for developing pneumonia, emphysema. You increase your chances for cancer.
I have a hard time breathing. I've noticed that. I just always thought that maybe I was a little bit overweight.
It has to do a little bit more with the smoking and your. I understand that reading your file, you were just diagnosed with gestational diabetes and you're 16 weeks pregnant as well.
That's correct. That's what my doctor says.
Okay, so that also puts you at a lot of other risk factors, and it puts you at a risk for developing a lot of other complications. So the main thing is that you're going to be putting yourself at risk for developing several types of cancers, which include lung, mouth, esophageal cancers, kidney cancer, cervical cancer.
Oh no, I don't want that.
So that's a pretty big thing because it increases your risk for developing those type of things.
That's scary.
And then also too, the Surgeon General puts out warning labels in those cigarettes, which can cause birth defects. They're known to actually cause birth defects when women smoke throughout the pregnancy.
Oh, I don't want to do that to my baby.
Yeah, so some of the things that happen with your baby, as it is, your baby's already predispositioned to a lot of complications based off your gestational diabetes.
Oh, that's so scary.
I'll let your doctor explain a little bit more about that because that's a little bit separate, and it's going to require a lot more teaching on that aspect. But when you smoke during pregnancy, it puts your baby and fetus, well, your fetus as it transitions into a baby, at risk for developing, abnormalities as far as, cleft lip. Basically, their mouth and lips don't develop properly.
Oh my gosh, that's so scary.
Okay.
Does that affect my baby's feeding?
It can potentially. Just depends on how advanced the defects are, and that's one of the reasons we want to catch this early and teach you these things. Hopefully, knowing the complications that can arise, it will help you kind of determine if you really want to quit smoking, and it will give you a little bit of insight as what can happen if you don't.
So this seems like it's a little bit of a reversal type of a process. I've always thought that by smoking I had caused irreversible damage. Do you think that I can reverse this smoking and get my lungs better all over again?
So as far as the reversing of the damage, there's not a lot of studies that have proven that. But definitely, if we can cut down, your current smoking and your future smoking, we can reduce your complications and kind of keep and maintain the health that you do have right now.
What if I cut from smoking the 2 packs a day that I used to smoke to maybe one? Will that make a difference?
It will make a difference because ultimately it's less, that you're doing. But I have a few little tips that or options that you can try out. I know you said you tried the gums, but there's a lot of other, interventions that we can do to kind of guide you through the smoking cessation process.
Wow, I'm interested to know. Can you tell me of a couple of options?
Yeah, so the first thing is the nicotine patch. And basically, what it is, there's been several studies that show if you're able to absorb the nicotine, which doesn't really cause a lot of problems with your pregnancy because you're avoiding the carcinogens, but you're still getting the nicotine, you can kind of wean yourself through it. So the patches are designed to be applied to your skin. And those can be bought over the counter. And when you get those,
does that hurt?
no, basically it's just a small film, and you're gonna put it on your skin, rotating the site once a day. You can also get specific doses in case you were used to smoking a certain amount of packs. You can get the patches and kind of taper yourself down gradually as they sell the patches in different doses. Once you feel that you're ready to kind of progress down on the dosage of the nicotine.
Well, that sounds like something I can do. Where can I get the patches from?
Like I tell you, they're over the counter, so you can get them at most convenience stores, grocery stores, things like that. You can find them there. Another thing is the gums that you tried. Were you chewing them properly or utilizing them properly?
I honestly wasn't really taking them seriously. I remember when I put them in my mouth, I would kind of chew on them, and once the flavor was gone, I would kind of spit them out because they were kind of gross.
Okay, so with the gum, you have to know how to utilize it. What you have to do is just kind of chew it and break it down and kind of mix it with your saliva to the point where it kind of feels like gum. But then the point is to put it on the side of your cheek so it can get absorbed through the tissue.
Does the gum come in flavors?
It does. It comes in a lot of different flavors, and like I tell you, those are also over the counter, so they're very easily accessible for you. The thing is, whenever you chew them and put them on the side of your cheek, you should be feeling like a small tingling sensation. And once that kind of stops, then at that point you can spit the gum out.
Well, that sounds like something I could do.
Okay.
Thanks for that information.
You're welcome. Another thing too, once you talk to your provider and you have a kind of set plan that you want to, once you tell them that you're straightforward about wanting to quit smoking, there are some medications that can help you with that. They kind of alter the chemicals in your brain, similar to what nicotine does for you, and it will kind of ease the cravings. One of the medications is called Wellbutrin. But with that, you have to kind of keep going, get continuous care through your provider to keep getting prescriptions. And then another thing with that is that the cost is, somewhat high due to being like a pretty pricey medication. It ranges between $15 to $30, depending on the insurance that you have monthly.
That sounds kind of pricey. I don't think I would be able to do that.
Okay.
I don't know. Do you have anybody you can refer me to that can help me?
We can definitely ask the provider, and then maybe we can have the social worker or the case manager kind of talk with your insurance and see if that's something that we can determine the cost for you, if you want to pursue kind of that choice as far as helping you quit.
I've heard about some medications like Chantix. How will that help me?
Okay, so some of those medications are contraindicated during pregnancy. So you're kind of limited with the things that you can do as far as medication goes, just because of the fact that some of those medications have a big impact on your body, and it penetrates through the mother fetus barrier. And it can also, the dose that you're getting is also being transmitted to the fetus. So we don't want that.
Well, that sounds scary. I don't think I want my child to be affected by that.
Correct.
Thanks for that.
You're welcome. Another thing too that you can do is you can do a lot of support groups. I went ahead and got 2 of the most commonly used that kind of pop up on Google as far as support groups that are most commonly used throughout the community. And I'm going to give you some pamphlets once this is over, which is going to give you a lot of detailed information. So one of them is called Set Your Date to Quit. And basically you kind of go in there and it gives you a lot of reading information, a lot of guidance. That one's a little bit more kind of self-paced, and it's kind of up to you to go in there and look for the information. And if you're not kind of too savvy with that, it might be a little bit difficult. But if you have a lot of, computer experience, that might help you.
Now, I'm afraid that I might be judged if I go to the support groups. I don't want to be judged. I've been doing it for so long and I don't know how to change.
Okay. Another option too that I went ahead and picked for you, and I'll give you a pamphlet of this as well. It's called Smoke Free. And basically you go in there and you register, and it's all online based. So what they're going to do is give you daily text messages. You have advice, you have hotlines, and you have the option of going to meetings if you want to kind of change that kind of your viewpoint, or you get a little bit more comfortable with meeting people. But this is a little bit more personal in the fact that it kind of sends messages just to you, which will kind of guide you through the cessation process.
Geez, thanks, Alonso.
You're welcome.
It's very helpful.
Another thing too, you told me you kind of had a lot of stressors going on in your life.
Yes, I do. I work full time, and sometimes I don't know what to do about this anxiety. Do you have any other options for me?
Yeah, one of the recommendations that I can give you is to kind of start jotting down some information about your feelings and things like that in a journal on a daily basis. And that way you can try and pinpoint exactly what's causing, the feelings to have to smoke.
I used to do that when I was a child, and that helped a lot.
Yeah, so it's very therapeutic. So you'll kind of tend to see that same, reaction to it, as it lets you get a lot of insight into your daily thoughts, and it gives you time to reflect on the way you were thinking at the times that you felt like smoking the most.
I found that it helped me when I was a child. Maybe I'll give it a try.
Okay, so this kind of concludes our teaching as far as interventions that we can do to help you smoke. We'll go back and I'll ask if you remember a little bit about what we talked about. That way we can see if basically you understood. It's not really a test, so don't take it like a test. I just want to make sure that you got the information that we talked about today, okay?
Well, that's fine.
Do you remember some of the strategies that, as far as medications and over-the-counter things that we talked about that you can utilize?
I know you mentioned about a patch. The gum I've tried before, I haven't gone back to that, but I'm willing to give it a try. Maybe I just wasn't using it correctly like I should have. The patch is something I would definitely consider.
Okay. And what about the medications?
The medication, Wellbutrin, I don't know too much about that. I'd have to read the pamphlets that you provided for me. But that sounds interesting, and I think I will do that.
Okay.
Maybe it'll help me.
And do you remember some of the complications that can occur from smoking, either in your health or your baby's health?
Yeah, I just can't stop thinking about the cleft lip you were talking about. How's my baby gonna eat?
So that's kind of a very dangerous complication that can occur. And basically, once your baby is born, he's going to be, in a position where he's going to have to get surgical interventions and a lot of therapy
Oh, no,
to
I
kind
don't.
of wean him into
Yeah.
a normal life.
That's very scary. I don't think I want to go down that route.
Yeah, so knowing like the in-depth and fully understanding the complications of smoking, I think that will kind of help you get into the right mindset when you really have those cravings, and hopefully this education kind of helps you get a little insight as to why smoking is really bad for you and why you should really consider stopping.
All the things that you've talked about really, really hit close to home. I think it's best that I think about my health a bit more now. Thank you for this teaching. I really felt it was beneficial.
You're welcome.
Thanks, Alonso.
Do you have any questions for me, Ms. Anderson?
Not right now, Alonso.
All right, you have yourself a good day. Thank you.
Thank you.